Cancer Journey Sharing in the Face of Remission, Year 6, Breast Cancer, to be presented by Miss Imelda Cabrera.
Please allow me to share with you my cancer story journey. Looking back, when I was always on overnight or with a few hours sleep every night, I neglected that my earthly body as the temple of the Holy Spirit also needed enough and proper rest. Later on, I noticed that a big lump formed in my left breast. I just neglected it, assuming that it will just vanish because in my mind, that breast lump was non-existent before. It just suddenly appeared. I did not suspect anything but just an ordinary bukol. I did not think of it as cancerous or malignant. Since the lump in my breast did not disappear, I decided to consult an OB. I was given a referral for breast ultrasound and mammogram. But due to my work hectic schedules, it took me almost 2 weeks to claim the result. Again, without prioritizing my health, giving my best to become productive at work was always my priority. After getting the result, I consulted our company physician and she told me to consult a surgeon ASAP as the lump was big. It did not cross to my mind to look for a breast specialist. My only concern was to have the lump removed. The first surgeon that I consulted explained to me that the mass will be removed and for biopsy. If the result is malignant, I will be operated again, removing my whole breast and the lymph nodes. I agreed and did not seek other surgeons' opinion anymore because I was confident that mine was just an ordinary bukol and I will not undergo another operation. I didn't know the characteristic of a cancerous lump until it was explained to me by Dr. Hoson and by attending his pep talks. Before the scheduled removal of the lump, I was required to undergo so many laboratories: ECG, chest x-ray, urinalysis, CBC, creatinine, blood typing, and other blood tests, and need to seek cardiologist and pulmonologist clearance before the operation. At the back of my mind, ang dami naman pinapagawa sa akin, bukol lang naman ang tatanggalin. But on my second operation with Dr. Hoson, he did not require any laboratory test, not even cardiologist and pulmonologist clearance. He just asked me if I had heart disease or hypertension. I really appreciated the practicality and frugality of Dr. Hoson. Since I was not empowered as a patient before, I complied all the required laboratories of my first surgeon, but incurring a lot of expenses. Few days after I was discharged from the hospital, I was shocked with the result of my histopathology report. It was grade 2 invasive mammary carcinoma. Upon knowing the result, para akong sinakluban ng langit. The questions that pop up in my mind were, ilang araw or buwan na lang kaya akong mabubuhay? Paano ang mga anak ko na nag-aaral pa, as I am the breadwinner in the family? My husband was no longer working then as he was not fit to resume for work anymore. I am full of fears and worries. Punong-puno ng hangin ang dibdib ko. Nawalan ako ng ganang kumain at hindi makatulog. Lahat na kinakain ko na masarap dati ay wala ng lasa. And I'm sure, We share the same feelings of those with the same diagnosis as mine. Upon knowing the result of the histopathology report, my first surgeon required me for a creatinine test, CT scans of the whole abdomen, brain, chest, and bone. This time, my HMO provider did not approve to pay the cost of those CT scans. According to them, they don't have any record that I have a history of breast cancer. I went back to my first surgeon inquiring if it was really necessary for me to undergo those tests, as we know how expensive CT scan tests are, and it will be shouldered out by my own pocket. As per my first surgeon, he wanted to know if there were metastases on other parts of my body. And here, I greatly appreciate Dr. Hoson, a minimalist doctor that requires diagnostic tests only if it is necessary. My first surgeon texted me for the schedule of another operation, the removal of my whole left breast and the lymph nodes. This time, I want the breast specialist surgeon to perform my second operation. In my scouting, I happened to talk to the head of the Manila Doctors HMO department, who happened to be a breast cancer survivor for 10 years then. She mentioned the name of her surgeon, Dr. Reynaldo Hoson, breast specialist, and Dr. Antonio Villalon, her oncologist, and she gave me their clinic schedules. She told me that I should not have been operated on twice. In her case, she was operated by Dr. Hoson, and she was put under a frozen section procedure, wherein at that moment, a portion of the tissue mass was given to the pathologist for Dr. Hoson to make a rapid diagnosis of a suspected mass during surgery. We talked for almost an hour, sharing her journey from the discovery, operation, treatment, and after treatment. She gave me encouragement and boosted my morale. Not to lose hope, just fight, have a positive outlook in life, and told me that life must go on as a cancer is not a death sentence. She said that great support system from family and friends are very important. When I left Dr. Garcia's room, I felt relieved. Nabawasan ng hangin ang dibdib ko at nagkaroon ako ng pag-asa. Indeed, cancer journey sharing gave hope for cancer patients to live on. This also inspired me to share my own story to provide comfort and inspiration to those who have recently been diagnosed with cancer. I also asked one of our company physicians if she knows someone who is a breast specialist, and she also mentioned the name of Dr. Hoson. I went to Dr. Hoson's clinic, and there he discussed everything in detail, and the procedure that supposedly has been done to me by my first surgeon, that I would not be operated twice and a needle biopsy should have been done if the mass is suspicious for malignancy. Napailing si Dr. Hoson, sabay-sabi, "Kawawa ka naman, dobling hirap mo at inubos pera mo sa mga unnecessary tests." True enough, because my HMO limit was exhausted, and I had to wait for the renewal of my HMO card for my second operation. Lesson learned was better to seek second or third opinion from other physicians, as more heads are better than one. When I went to the clinic of Dr. Hoson before my second operation, he discussed with me the treatments, emphasizing the benefit, risk, cost, and availability. surgery, modified radical mastectomy was the best option. He also reiterated that he will not let me stay long in the hospital. He will discharge me the following day after my operation at sa bahay na lang daw magpapagaling. Dr. Hoson also stated in my admission slip not to use the Isonic shower bath kit. It was an expensive antibacterial soap. Instead, to use my preferred bath soap. With that, I greatly appreciate him and I thank God for leading me to a competent and compassionate physician. When I got my immunohistochemistry breast panel report as the basis for my treatment after my modified radical mastectomy, the result was ER/PR positive and HER2 positive, meaning the cancer cells were aggressive. I was referred by Dr. Hoson to the medical oncologist, and my treatment would be chemotherapy for 6 to 8 sessions and Herceptin for 18 sessions. The Herceptin then cost 80 to 100,000 per session and to be administered every 21 days. The total cost of chemo and Herceptin would be more than $1 million. I was working so hard for the future of my children, and all of my savings will just be used for my treatment without assurance that the cancer will not recur. I went back to Dr. Hoson telling the recommended treatment of the oncologist, but I refused to do so. I don't want to use all my money on my medication as I have 2 children that are still studying then. Dr. Hoson then prescribed me tamoxifen, a hormone therapy for my ER/PR positive, and he told me to buy the cheapest brand. I did not undergo chemotherapy at Herceptin as I don't believe in the medical report that my cancer cells were aggressive. What I am believing is God, as the author of my life, is more aggressive to heal than the cancer cells to spread. That God has the final say that I will be healed through His supernatural healing power that medicine cannot do. I thank God for the early diagnosis as I started my healthy lifestyle, and Dr. Ray Hoson for his informative and life-changing pep talks. With a grateful heart, I changed my outlook in life, believing that something wonderful is about to happen, as our positive thoughts could make us well. All we need is a big faith that our latter days will be better than our former days, that the best is yet to come. I am Mel Cabrera, 55 years old, a breast cancer survivor for 6 years and counting. Through God's amazing grace, I declare that I am completely healed, I am healthy, I am happy, and free from all fears and worries. To God be all the highest glory.